I bet.
Okay, so we're being live streamed. I will go to a different view here.
I set up everything now, David. So feel free to take it over, share your screen now.
Okay, I've got my screen up, Mila. Can you see it?
Yeah, you had to click share screen.
I did. Let's try this again. Okay, we will share this screen. How's that?
Yes.
All right. All right, can everybody in our Chinese language friends see the Chinese language at the bottom of the screen?
Yes.
All right, then we're all cooking with gas. Mm.
Ready to rock and roll.
Yeah, ready to rock and roll. So today is the 9th part of our endocrine system on happy hormones or hormone happiness, as the case may be. And we're going to talk about testes today. All right, so we've been down quite a path as we've gone through our presentation on relationships and increased intimacy. And we have been inside of the glands and their hormones now for quite some time. And we're coming down to the end, and we are on to the testes today. And then the next presentation will be on ovaries. And then we'll be getting down further into this series. And why are we doing this is it's basically to help people find their happiness and healthy and living fully in happiness and health. And then it's necessary to talk about hormones because they have such a big impact upon how we feel, and how we feel is directly related to how we interact. And the endocrine system is all about your hormones. So we have been through the hypothalamus, which we remember is the connection between your nervous system and your endocrine system. The pineal gland, which is your third eye that gives you the insights and your dimensional being, as it were. Many people think of this in terms of soul. We have the pituitary gland with the control gland. This one here generally is all about sending out additional hormones from the signals it gets from the hypothalamus to start controlling. And we will see that today in terms of the hormones that we see coming from the pituitary to the testes. So it's and remember that the hormones are chemical transmitters. They release small amounts of hormones into the bloodstream, and then these hormones are transported inside the bloodstream to all parts of your body, and then they're picked up by target organs or target cells within those organs. And they're chemical messengers rather than electronic messengers. So we want to keep that relationship. So this is a slower acting behavioral change than would be if you had a nervous system change, for instance. So in the testes now, what are the testes? Well, commonly they're referred to as the testicles. And if you can see my little arrow, can you see my arrow? This is the scrotum. All right, you'll all recognize the penis. This is the scrotum here, and inside the scrotum is often referred to as the ball or the egg, but it is actually referred to as the testicles or the testes or testis if you're only referring to one of them, because there are two of them. They're responsible for the production of sperm and the male hormone testosterone. And I try to leave out the word sex because of the fact that both genders have testosterone in them and need testosterone in order to function. So while the testosterone generally is referred to as creating the male or masculine characteristics, it's also necessary for the creation of estrogen, and it's also part of what is created from estrogen inside of men. It's also generated here in the testes and then also in the adrenal and the pineal gland of your body. So for instance, when your ovaries in a woman stop generating estrogen, for instance, then you'll get your estrogen from your pineal gland, but at the same time, you're going to have a generation of testosterone. Okay, so basically, what is the testosterone in testes? We get the creation of sperm inside the testes, and I want you to pay attention to these numbers here, just so that you have a perspective. Whereas a woman will generate a single egg for close to a single egg, depending upon their ovulation, but will have a single egg. The testes will generate 12 trillion sperm in a lifetime, and like about 12 million every day. Now think about that. If this guy's generating 12 million every day, he's got to get rid of 12 million every day. All right. So we're talking about making and maturing billions of sperm inside of the testes. Each sperm produces, takes about 72 days to mature from the time that it's becomes as a single cell to its maturity to be able to be expelled. Takes about 72 days. Now the scrotum has a built-in thermostat, and these, in order to keep the testes at the right temperature for sperm development, and this happens to require the testes to be outside the body because the body itself is too hot for the production of sperm. So spermagenesis, which is the creation of sperm, requires temperature that's either 3 to 5 degrees less than body temperature. So that's why the scrotum is outside of the body, to keep it cool. Now think about this is that you want to consider the fact that if your underwear on a man is too tight, then his scrotum is too close to the body, and therefore the temperature of the scrotum is going to be higher than what it needs to be for sperm development. So one of the findings in the ability to have babies, or to have a better chance of having babies, and fertilization, is to watch the temperature of the scrotum and keep it farther away from the body than closer to it, so that the temperatures are cooler. All right. Testosterone, of course, is necessary for the development of boys. And I want you to also appreciate the fact that there are different types of testosterone, as there are with so many of the hormones. Now, remember, we learned about hormones. You have about 50 hormones in your body right now functioning actively. They're actively involved in what's going on in your body, 50 different hormones. And we're only going to be talking about a few of them today. But there are over 150 hormones in your body. And there's just no way to get and talk about every single one of them. But the fact of the matter is there's some that do things that we recognize and some that we have no idea what they do yet. And so that's what makes the excitement in human development and anatomy and science and medicine and so forth so very interesting, is because there's so much that we do not know. We can identify things, but we still don't know what they do. So here we are. We've got testosterone is a type of androgen, which has the characteristics of masculine development. And as I was developing this course, I wanted to relay again the need to talk about DHT, or dihydrous testosterone, which as you age is damaging to both men and women. Okay. And we try to get the dihydrous testosterone out of the body. One in the men is that it has a deteriorating effect upon the prostate, which leads to prostate enlargement and then potentially to prostate cancer. And in women, dihydrous testosterone will do a number of things, make hair grow where you don't want it, and also to lose hair on your head, because essentially male pattern baldness is created by dihydrous testosterone. And so therefore, if you've got too much dihydrous testosterone in your body, you will lose hair. And how do we get it out? Well, we've got science to tell us that, and that's the saw palmetto. All right, so for you women on the screen here, think about this, is that you don't want dihydrous testosterone. Free testosterone you do want, okay? Free testosterone leads to libido and your enjoyment of sex. So, but dihydrous testosterone is damaging and you want to get it out. And saw palmetto is the preferred product mechanism for getting the dihydrous testosterone. So when somebody tells me that the estrogen from USANA is for women and saw palmetto from USANA is for men, I say, time out, big T for testosterone, okay? Use the saw palmetto to help yourself, women, to remove your dihydrous testosterone. And you are generating dihydrous testosterone in your body, and you only want to have the free testosterone because that's the part that will keep you active and involved. Okay, during puberty, testosterone involved in healthy development of sex organs, the growth. Now, one of the things about the difference, in men is they don't start generating sperm until they reach into puberty, whereas women are born with all the eggs they're ever going to have. So this is a big difference. So in the process of developing during puberty, there's going to be a signal from the pituitary gland with the information from the hypothalamus to send down to the testes to start generating testosterone. And that's when you start beginning to see more development of the sex organs, the facial hair, the lowering of the voice, the increase in the height, and the increase in the muscle mass. So generally speaking, when you remember, boys are usually shorter than girls up until about 10 or 12. And then after that, they just go, above and get broader shoulders and so forth like that. Okay, so I wanted to go backwards because I wanted to point out this, one more this way. Okay, that way. Okay, so at the bottom of the screen, you'll see this blue line right here. I want to point that out. That's a good reference. So when you pull down the presentation, you can use this to do research into hormones. It will give you paragraphical summaries of the glands as well as the different hormones, A to Z. But testosterone is not just limited to puberty. Throughout your adult life, the hormone helps maintain your libido. And as men age, they generate less and less testosterone, okay? Because as they age, nature has said that they've completed their job of propagating the species, and therefore they don't need it as much. Unfortunately, with less libido, there's less enjoyment. So therefore, you have this dichotomy or this difference between losing testosterone and then trying to maintain active sex life. All right, you need it for sperm production because throughout the man's life, he's generating these 12 million sperm every day, and then basically it's going to drop off over time, right? You need it for maintaining your muscle strength and muscle mass. You need it for your bone density, for men's bone density. Women rely more on estrogen for bone density. Then also, we talked about the relationship between the hypothalamus and the pituitary gland to control how much testosterone. So when we talk about it's all in your brain, it's all in your brain, because the hypothalamus and the pituitary gland are okay. So with the hypothalamus, it sends a signal down to the gonatropic substances known as the follicle stimulating hormone and the light sensing hormone. Now, we both in male and female have these two hormones. In each of us, they do different things. In the light sensing hormone, it stimulates testosterone. So when it gets down to the gonad, it tells the gonad to actually stimulate the production of testosterone, and the follicle stimulating hormone, the FSH, actually causes the maturation of the sperm, causes it to grow and to become the head, the body, and the tail, and the creation of the various different cells that are required in order to create that maturation. So if you can see over here, this is the brain. You've got the pituitary, the hypothalamus gland right in here, the pituitary gland's right here, and it's sending its FSH and LH down to the testes right in here. All right, talking about that, we've not just what it does, but what if something goes wrong. We want to make sure that everyone understands that just like women have to massage and feel for lumps in their breasts, men need to be feeling for lumps in their testes. Testicular cancer is a real thing. It's dangerous, and obviously we need to make sure that if you can find it early, you can treat it. It is treatable. It's generally speaking, most lumps inside the testes are benign. They're either a cyst or some other common characteristic, but there are times when those need to be identified to the physician so that it can be analyzed for cancer. So do the testicular analysis, do your health exams, and the mechanism for doing this health exam is to hold the testicle at the bottom and then lightly massage it, and now you're going to be feeling for lumps or unusual substances within the testes. The more you do it, the more familiar you're with it, so therefore you can judge changes faster. So start early and don't forget to do this. Just like everyone's women are looking for breast cancer, men need to be looking for testicular cancer. All right, so if you're not familiar with the male anatomy, the testes are right in here, right? The penis is in here, right? We are now ready to go into the videos. Mila, take it away.
Okay, give me a couple minutes. I'll put the video on. Start with the testes anatomy, right?
Right. Go from the top to the bottom. You need for me to do anything, Mila? Oh, there we go.
This video, anatomy of the male reproductive system. Let's begin by simply identifying structures that are important in the male reproductive system. These include the vas deferens, also called the ductus deferens, the penis, the testes, note that only one testicle is shown in this diagram, the scrotum, the bulbourethral gland, the prostate gland, and finally, the seminal vesicle. You have to have a basic understanding of location in order to understand function and how all these structures work together. We will begin with the testes, the male gonad. This is a diagram of the longitudinal section through one testicle, so you can now see what's inside. Notice that the majority of the testicle is composed of seminiferous tubules. These tubules produce sperm via spermatogenesis. But how? Let's take a closer look. In order to do this, we need to zoom in on the seminiferous tubule and take a cross-section through the tubule. Imagine taking a garden hose and cutting it in half. This would be similar to cutting the tubule in half and looking at what's inside. The lumen of the seminiferous tubule is lined by cells called Sertoli cells. These Sertoli cells are connected via tight junctions. Lining the outside of the Sertoli cells is a layer of smooth muscle. Outside of the Sertoli cells are the Leydig cells. These are all the cells that are really important. In addition to these structures, you will need to be familiar with the following compartments: the basal compartment and the luminal compartment. These compartments are basically talking about regions of the cross-section. If we are talking about the basal compartment, we are talking about the area that goes from the tight junction toward that smooth muscle. And if we are talking about the luminal compartment, we are talking about the area that goes from the tight junction toward the lumen. Now that you are familiar with the structures, let's focus on their functions. We begin with the Leydig cells, also called interstitial cells. The Leydig cells secrete testosterone. The Sertoli cells support sperm development, or what is referred to as spermatogenesis. The smooth muscle surrounding these Sertoli cells allows for peristalsis. This process is important as it will propel sperm through the seminiferous tubules. Well, that's all fine and dandy that the Sertoli cells produce the sperm, but how do the sperm get out of the seminiferous tubules and out of the testes? This is our next goal. So here are the sperm in the seminiferous tubules. The sperm has been produced by the Sertoli cells and released into the lumen of the seminiferous tubule. Those sperm then travel through this little region here called the rete, testes, and into the efferent ductules. This is the point at which the sperm exit the testes. From the efferent ductules, the sperm enter the epididymis and will ultimately make their way to the vas deferens. So that is the pathway the sperm are taking to get out of the testes. What propelled the sperm through all those structures? Peristalsis. Now the sperm are in the vas deferens, right? The vas deferens connects with the seminal vesicles to form the ejaculatory duct. At this point, the sperm is mixed with fluid that came from the seminal vesicles. The ejaculatory duct penetrates through the prostate gland to join the urethra. As such, the sperm wind up in the urethra, which receives substances from the bulbourethral glands. Thus, both urine and sperm are in the urethra. So that was just the pathway that sperm take from the seminiferous tubules to the urethra. Now, let's look more closely at the accessory glands I mentioned earlier. The seminal vesicles secrete an alkaline fluid that contains fructose, enzymes, and prostaglandins. Remember, alkaline fluids are basic. The purpose of this alkaline fluid is to neutralize the acid that is in the female reproductive tract. The fructose is used for energy. Remember, sperm have to swim, so they need energy for motility. The enzymes in the fluid facilitate semen clotting. There are also prostaglandins in this fluid. These are for motility and viability of the sperm. The prostate gland is another accessory gland. The prostate gland secretes citrate, which is an energy source for sperm motility and enzymes that will break down the semen clot once it is in the female reproductive tract. Okay, so take a second to make sure you understand. The semen clots during ejaculation and is then broken down once it's inside the female reproductive tract. The last accessory gland is the bulbourethral glands. These glands secrete a fluid that contain mucus. Why is mucus important? It serves as a lubricant.
All right, University of Oklahoma. Now, when the semen comes out, it's in a thicker format, and then it breaks down. So when they're referring to the semen clot, that is the mucosal format as it comes out of the penis and then it gets into the vagina and then starts breaking down in order so that the actual semen can actually swim up through the uterus and into to approach the egg. So that's all part of it. The energy, when we get to the look at the actual semen, the mitochondria that are in each one of the sperm is for the energy. The tail is for the propellant, right? And in later videos, we'll see more about that. Okay, Mila?
Gonads are known as testes, and testes serve two important roles. Firstly, they play a role as a reproductive organ, so that means they produce specialized types of cells known as sperm cells that are involved in our human reproduction cycle. And secondly, testes also play a role as an endocrine gland, and that means they are capable of releasing and producing specialized hormones that are required by our body. Now, in this lecture, we're going to focus on the latter. We're going to focus on the endocrine capability of testes. Now, if we take a cross-section of the testes, we basically get the following diagram. And within this diagram, we have a specialized section known as the seminiferous tubules. And this is what we're going to focus on in this lecture. So these tubules shown in brown are the seminiferous tubules, and if we examine the microscopic section of the seminiferous tubules, we basically get the following diagram. So within our seminiferous tubules, we have two very important types of cells that are involved in sperm production as well as in the production of our androgens, the male sex hormones. So we have Sertoli cells, which are these large cells shown that contain the blue nuclei as shown. And connecting these Sertoli cells are the intercellular junctions, the tight junctions, which basically create a watertight seal. Now, below our Sertoli cells, what keeps our Sertoli cells together and attached to a membrane is this basement membrane layer. And below that, we have these fibroblasts, which are specialized types of cells that produce and release collagen that forms the extracellular matrix that surrounds our cells. Now, the other important types of cell that we have to know is our Leydig cell. This is also known as the interstitial cell, and these Leydig cells are shown in green. So we have the Leydig cells, we have these Sertoli cells, and we also have these red structures, which are the capillaries that bring not only nutrients and oxygen, but also important types of hormones to our testes, to our seminiferous tubules of the testes. So in our discussion on the hypothalamus and the anterior pituitary gland, we said that the hypothalamus produces and releases a hormone known as GnRH, which stands for gonadotropin releasing hormone. And this hormone stimulates the anterior pituitary gland to release two important types of hormones. We have the follicle stimulating hormone, FSH, and luteinizing hormone, also known as LH. Now, when the luteinizing hormone is released into our bloodstream, it travels down to the capillaries of our seminiferous tubules and it attaches to the cell membrane of these Leydig cells, and it basically stimulates these Leydig cells to release a special type of androgen known as testosterone. Now, testosterone is a steroid hormone, and that means it is lipid soluble and it can easily pass across the cell membrane of target cells. So the receptor proteins of testosterone are found inside our cell. Now, testosterone has many important functions. Firstly, it basically stimulates and initiates the production of our sperm cells inside these regions between our Sertoli cells. And we'll discuss what the function of Sertoli cells are in just a moment. Now, it also initiates secondary sex characteristics, including the growth of pubic hair as well as under armpit hair, and it also enlarges our larynx, and that is what gives us a deeper voice when we're undergoing puberty. Now, it also is responsible for initiating the process of puberty, so basically our growth spurt. This involves the growth of not only our muscle but also of bone. So it increases the bone and muscle mass in our body during the process of puberty. Now, it is also involved in actually preventing a condition known as osteoporosis. Osteoporosis is essentially the breakdown of our bone matrix as a result of old age. And it also stimulates the closure of our epiphyseal plate found in our long bone. So it's not only involved in actually elongating our bone, but it is also involved in ending the process of elongation in our long bones. Now, as time progresses and as our Leydig cells continually release our testosterone into our blood, that increases the level of testosterone in our blood. And as the blood testosterone level increases, the testosterone can actually go and inhibit the hypothalamus from releasing the gonadotropin releasing hormone, and it can also inhibit the anterior pituitary gland from releasing our luteinizing hormone as well as the follicle stimulating hormone. And this type of pathway is known as negative feedback inhibition or negative feedback mechanism. Now, what about our follicle stimulating hormone, and what about the Sertoli cells? Well, the Sertoli cells are these cells shown here. Now, once the follicle stimulating hormone is released into our bloodstream, it travels to the capillaries of this region and it causes these Sertoli cells to basically provide the nutrients needed to our sperm cells for them to actually develop into mature sperm cells. So in males, the follicle stimulating hormone stimulates the Sertoli cells to provide nutrients to the developing sperm cells. Now, as time progresses, what our Sertoli cells can do is they can basically release a glycoprotein hormone into our surrounding area, into our bloodstream, known as inhibin. And what inhibin does is it goes into our bloodstream and it travels to our anterior pituitary gland, and it basically inhibits via a negative feedback loop. It inhibits the release of our follicle stimulating hormone from the anterior pituitary gland. So to review what we just discussed, let's take a look at the following flow chart. So let's begin with our hypothalamus. So the hypothalamus produces a hormone known as GnRH, the gonadotropin releasing hormone, which then travels to the anterior pituitary gland through the hypophyseal portal system. And once it attaches to the endocrine cells in the anterior pituitary gland, it causes those endocrine cells to release the follicle stimulating hormone and the luteinizing hormone. Now, the luteinizing hormone travels through our bloodstream and eventually attaches onto our Leydig cells, and it stimulates those Leydig cells to release testosterone. At the same time, the follicle-stimulating hormone attaches onto our Sertoli cells, and it causes these cells to basically provide the nutrients to our developing sperm cells, while testosterone actually initiates the development of our sperm cells into mature sperm cells. At the same time, testosterone also causes these other different effects. So, for example, it's responsible for actually creating that growth spurt. It's responsible for giving us our secondary characteristics, such as our enlarged larynx, a deep voice, our pubic hair, and other things of that nature. Now, when our concentration of testosterone is very high, it can basically travel back into our hypothalamus and inhibit the release of GnRH. It can also inhibit the release of FSH and LH from the anterior pituitary, while the Sertoli cells can basically create a protein hormone known as inhibin that goes on and negatively inhibits the release of FSH from our anterior pituitary gland.
Right. So we get down to that and try to pull together some things. One of the things that's really comes to mind is the fact that women have hair, underarms and so forth, and oftentimes try to remove it. And one of the reasons in history that is true is that you didn't want to give off a feeling that you had too much testosterone in your bodies. That was being outward indicator of too much testosterone and not enough estrogen. Of course, they didn't know testosterone and estrogen, but what they knew was the female characteristics versus the male characteristics. All right. Next one, Neela.
Okay.
There we go. We've got Thekla joined us. Mike joined us. Hello, Mike. Hello, Thekla. Gwen, nice to see you too.
Discuss the hormonal regulation of male reproduction. Let's start with what you are already familiar with. That is the hypothalamus and the synthesis and secretion of gonadotropin-releasing hormone, GnRH. Once secreted, gonadotropin-releasing hormone will bind to receptors on the anterior pituitary, causing the endocrine cells to synthesize and secrete both FSH and LH. FSH stands for follicle stimulating hormone. And LH, remember, is luteinizing hormone. LH, as we discussed in previous videos, will stimulate the Leydig cells of the testes to synthesize and secrete testosterone. Testosterone will then enter the plasma and cause target cell responses. Let's review those responses. Testosterone will target skeletal muscle, causing protein synthesis. Testosterone will target the brain to increase sex drive. It will also target the Sertoli cells to stimulate spermatogenesis. Testosterone will promote the development of secondary sex characteristics and the maintenance of those characteristics. Here are a couple of other responses that we have not yet talked about. Testosterone will stimulate growth hormone, GH, secretion, which will stimulate bone growth during adolescence. And finally, testosterone will stimulate the Wolffian ducts to promote development of male reproductive structures during embryonic life. Now let's turn our attention to FSH. Like LH, FSH will bind to receptors on the Sertoli cells to stimulate spermatogenesis, as well as the synthesis and secretion of a protein hormone called inhibin. Since we are talking about inhibin, this is a good time to talk about how to shut down the system. You are already familiar with negative feedback using testosterone. Remember, testosterone will bind to receptors on the hypothalamus and the anterior pituitary. This will shut off the synthesis and secretion of gonadotropin-releasing hormone and luteinizing hormone. Inhibin will bind to the anterior pituitary and shut off the synthesis and secretion of FSH. To sum it all up, negative feedback shuts off the synthesis and secretion of gonadotropin-releasing hormone, luteinizing hormone, and follicle-stimulating hormone, which will all lead to the decrease in the synthesis and secretion of testosterone.
Now, how many of you remember the term cascade? That is hormonal cascade. In looking at that, the feedback mechanism is to keep everything in balance. You get generation, it starts generating, and then you get the testosterone or whatever the hormone is back into the bloodstream, and then it shuts off the generation of that same stimulating hormone that created in the first place. And if everything works well, everything stays in balance. The issue comes down to is when things get out of balance. That is when the negative feedback isn't working, or it works too well and keeps the hormone from being initiated. So these are the things that are fascinating, but also important to know that not all the time everything works the way it's designed. Okay, Mila.
Pancreas.
Oops.
Pancreas
No,
is a mixed.
Go ahead and stop this one, Mila. Obviously, we missed the connection on this one. All right, just go to the next one. As we talked about the pancreas, there we go, like this guy.
It's a big gamble. I mean, the mental risks alone that we take relationships are taxing enough. When is he gonna text me back? Am I good enough? What if she doesn't like the real me? But the emotional price we pay for intimacy can almost seem paltry compared to the physical investments that our bodies make in order to reproduce. And the sexes each make this wager differently. The female gamete is, biologically speaking, a big bet. It's like putting all your chips on black. An ovum and a follicle take over a year to develop, and as human cells go, it's huge, about 1/10 of a millimeter, just large enough to be seen with the naked eye. Plus, it requires a whole network of supporting tissues in the uterus while it waits for fertilization, which, if that doesn't happen, then have to be shed and rebuilt a month later. And then there's the commitment. Once an egg has been ovulated, everything in the female reproductive system is dedicated to dealing with that one cell for almost a month. And if it gets fertilized, you're looking at 10 months. So when it comes to playing the reproductive roulette wheel, the male reproductive system takes the opposite strategy. If female gametes amount to a high-stakes bet, the males are basically the penny slots. Human sperm are only about 100,000th the mass of an egg, and they're almost as easy to produce as skin cells. Actually, the process by which they mature is pretty similar. That's because sperm are small and stripped down, not invested in much beyond a nucleus and a tail and some extra mitochondria to fuel the journey. All they have to do is drop their DNA and fall apart. The risk of failure is still there. In fact, with male gametes, the odds are overwhelmingly against any single sperm actually accomplishing its mission. But while the female reproductive system meets this risk head-on with a single big play, the males tries to beat the odds with sheer force of numbers. Here's a question for you. Why are the most important parts of the male's reproductive system literally left hanging? The testes, the gonads of the anatomical male, are tasked with making male gametes, sperm, and the androgen hormone testosterone. But unlike the ovaries, which are protected inside the body, testicles dangle outside the abdominal cavity in the scrotum. Because, even though sperm may not be terribly big or complex, they're touchy when it comes to temperature. The rate at which they divide, copy DNA, and even feel the effects of some hormones are all diminished at the core body temperature of 37 degrees. So the testes have to be outside the body cavity to reach the lower temperature necessary for proper spermatogenesis or sperm production. It's a rare instance of sensitivity among what are otherwise pretty hardy and expendable cells. But that's not to say that the testes aren't complex. Each one is divided into about 250 sections called lobules, which are loaded with tightly coiled seminiferous tubules. These tubules are the sperm factories, made of a stratified epithelium surrounding a central fluid-filled lumen. And this sperm-making work is supported by cells throughout and around the tubules. Among the most important are the Sertoli cells inside the tubes, which nourish developing sperm cells, sort of like how female follicle cells help oocytes. There are also Leydig cells that secrete testosterone, much like the corpus luteum that secretes estrogen. But compared to egg making, spermatogenesis is, as I mentioned, a pretty cheap and easy process biologically. It's kind of like how your skin cells are produced, with stem cells at the basal layer that produce immature cells, which in turn get forced toward the surface as they mature. But in this case, the sperm develop on the outer edge of the tubule and progress inward toward the lumen. And it all begins with a trigger that, if you've seen our lesson on female reproduction, should look pretty familiar: a hormonal cascade. When puberty comes a-knockin', the hypothalamus starts releasing gonadotropin-releasing hormone, or GnRH, and this tells the anterior pituitary to secrete follicle-stimulating hormone and luteinizing hormone into the blood, just like in females. But in females, LH leads to the release of estrogen in the follicles, whereas in males, it spurs the Leydig cells to release testosterone. Meanwhile, the FSH triggers the Sertoli cells to release androgen binding protein, or ABP. This binds to the testosterone, creating large local concentrations of the stuff, which is ultimately what triggers the production of sperm. The targets of the testosterone are the outermost cells in the tubules, called spermatogonia. They're the stem cells that set the sperm-making process in motion by dividing. And actually, they've been doing that all along, even before puberty. Throughout childhood, a spermatogonia cell uses mitosis to continually divide into two identical daughter cells. So when puberty starts, the testosterone causes them to divide differently. Instead of splitting into two identical spermatogonia cells, they begin producing two distinct spermatogonia. One type of daughter cell, known as a type A cell, stays up near the basal lamina and just keeps dividing, so you never run out of spermatogonia. But the other kind, the type Bs, get pushed down the tubule toward the lumen and turn into primary spermatocytes. These primary spermatocytes then go into meiosis I and form two smaller haploid cells called secondary spermatocytes. They then rush through meiosis II, and their resulting daughter cells total 4 round spermatids. These spermatids now have all of the 23 chromosomes they need for fertilization, but they aren't exactly mobile. If they're ever gonna find themselves an egg, they need a way to get around. They need a tail. The process by which a spermatid elongates, grows a tail or flagellum, and officially becomes a mobile sperm is called spermiogenesis. And the whole process takes about 5 weeks, but it's not like it holds anything up because there are plenty more where those spermatids came from. In the end, each primary spermatocyte gives rise to 4 actual sperm, and considering how many spermatogonia are continuously dividing into spermatocytes, it's easy to see how a mature male can crank out 1,500 sperm a second. That's a far cry from all the investment that goes into making a single ovum. Now, obviously, if sperm are gonna get anything accomplished, they have to leave the seminiferous tubules that made them, so even once they have tails, they still need a little help getting going. That's why each tubule is surrounded by several layers of myoid cells, which, like smooth muscle, rhythmically contract using peristalsis to squeeze sperm and some fluid secreted by the Sertoli cells through all the twists and turns toward their next destination, the rete testis in the posterior testis. From there, the sperm, although still immobile, leave the testes by way of the epididymis, a long tangled set of tubes behind the testes where they'll spend the next few weeks gaining their mobility. The bulk of the epididymis consists of the enormous duct of the epididymis, which, believe it or not, could be uncoiled to stretch about 6 meters. Though I don't suggest doing that. This duct is full of tiny microvilli called stereocilia, which provide a huge surface area to help reabsorb some extra fluid and help pass along nutrients to feed the idling sperm. It takes sperm nearly 20 days to work their way through this labyrinth, during which time they continue to mature. Once through the duct, they enter the inferior epididymis, where they gain mitochondria, so they'll have energy to swim hard at a moment's notice. At this point, they have all the hardware to swim, but still lack the ability to actually move on their own hormone, a skill kept under wraps until they leave the epididymis and get activated by a series of glandular secretions. When that time comes, during ejaculation, the sperm flow from the epididymis through the vas deferens, a tube that travels up behind the bladder and joins with the duct from the seminal gland to create the ejaculatory duct. The left and right ejaculatory ducts pass into the prostate gland, where they empty into the urethra, which runs from the bladder through the penis and into the outside world. This system of tubes feeding into tubes allows all of the necessary glands to make their contributions to a moving wave of seminal fluid that helps sperm mature and perform their ultimate function, fertilization. The resulting mix of sperm, testicular fluid, and gland secretions, which we call semen, provides sperm with transportation, nutritional energy, chemical protection, and finally activates their motility. So let's take a look at these glands. The seminal vesicles are a pair of small, hollow glands behind the bladder that secrete a yellowish, slightly alkaline fluid that contains coagulating enzymes, fructose, and other things to help nourish and transport sperm. Interestingly, the vesicles also secrete special prostaglandins that help increase sperm success outside the body by decreasing the viscosity of a female's cervical mucus and actually triggering a reverse peristalsis of the uterus that helps draw sperm up the female reproductive tract. Now, the prostate gland encircles the urethra just inferior to the bladder. During ejaculation, it contracts to squeeze its own special secretion into the urethra. This stuff contains mainly citric acid and an enzyme cocktail that helps keep semen liquefied and thus easier to move and swim through. And finally, we have the pea-sized bulbourethral glands below the prostate that secrete a clear mucus that drains into the urethra to clear out any acidic urine prior to ejaculation. Speaking of, by now you may be wondering if we're ever gonna get to what's probably the first thing you think of when it comes to the male anatomy. The penis hangs from the perineum, between the pubic bone and coccyx. It consists of a shaft that ends in an enlarged tip called the glans penis, surrounded by a fleshy cuff of foreskin. Internally, the penis contains 3 layers of erectile tissues, each wrapped in a layer of dense, fibrous connective tissue. This spongy network is made of connective tissue and smooth muscle that's full of tiny vascular spaces that fill with blood during sexual arousal and make the penis expand and become rigid. The resulting erection is what helps the penis penetrate the vagina. And the fact that we're only now getting around to talking about it here at the end should tell you that, as with the female external genitalia, the penis isn't actually all that important in terms of overall reproductive function. Evolutionarily speaking, it's just a delivery system designed to get male gametes as close as possible to female gametes and reap some payoff for their investments. Now, what that payoff looks like in terms of fertilization is where we're headed next week. But for now, you learned probably all you'd ever care to know about testicular anatomy, the steps of sperm production, and how it's influenced by gonadotropin and testosterone. We also looked at how sperm mature and how they leave the body on a tide of glandular secretions during ejaculation. Thank you to our headmaster of learning, Linnea Boy.
All right. Well, super. Now, do we have anyone who wants to come off and ask any questions at this point? Okay. All right. So at this point, we're going to go now talking about some of the things that we need to be paying attention to in order to stay healthy. We're going to talk about testicular cancer and other scrotal pain issues in the next 2 videos. So let's go ahead and take it away, Mila.
Most commonly, testicular cancer usually presents with a mass that appears within the testicle. There may be things that occur that draw the patient's attention to that mass, for example, pain or discomfort in the groin area, or trauma. Sometimes people have trauma to the area and all of a sudden it draws attention to the area and they examine themselves, or someone examines that area and they feel a firm, solid mass within the testicle. That is a classic appearance of testicular cancer. Until proven otherwise, any solid, firm mass within the testicle should be considered as a potential cancer. Although there are other things that can cause similar findings, that's one of the more common presentations. Testicular cancer can spread to other parts of the body, including the abdominal area, the chest, and various other areas. And when it does do that, then patients may notice symptoms due to the spread of cancer to those sites. For example, when cancer spreads to the lungs, patients may have shortness of breath or difficulty breathing. Cancer can spread through the lymphatic channels to lymph nodes in the body, and so sometimes if there's extensive spread, patients may feel lumps in the neck area or the groin area, various other parts of the body that may signify the presence of cancer. But in general, most of those cases, most cases of testicular cancer will also have some form of a mass within the testicle itself. It's not always a 100% guarantee, but most commonly that's the way it presents.
Okay. So once again, we need to be sure that every male is doing a self-test. And if you are the female of a partner that doesn't do it, you need to encourage them to do it, or to do it for them, to feel for these hard lumps. If you've not felt a testicle before, it's generally speaking very, very soft and kind of spongy or rubbery, but a hard nodule will be like that, like a pea or a grain of sand, or along that line, a hard mass. And it's similar to what you're feeling for when you do a breast exam. So looking at that, feel for those, and then report them and get care for them, because you definitely do not want your testicular cancer to spread. And note that testicular cancer is easily treatable, but once it's spread, it is no longer easily treatable. Scrotal pain.
There are several serious conditions that cause scrotal pain that cannot be missed, including testicular torsion, usually presenting in younger males, and Fournier's gangrene, usually seen in diabetics. When evaluating a patient with scrotal pain, consider the age of the patient, the nature and duration of the pain, and the presence or absence of a mass. Acute, severe testicular pain in a child or adolescent is testicular torsion until proven otherwise. A scrotal ultrasound should be obtained to rule it out, and surgical exploration within 4 hours is necessary to avoid testicular loss. In an elderly diabetic with overlying cellulitis, be suspicious for Fournier's gangrene. Look for black, foul-smelling penile, scrotal, groin, and perineal lesions representing a necrotizing fasciitis. Urgent surgical debridement and broad-spectrum antibiotics are necessary. A mass may be present in a patient with scrotal pain. A good history and physical examination plus a scrotal ultrasound will help rule in or out common causes, including hydrocele and epididymal cysts. Also remember that while testicular cancer is usually painless, in men between 15 and 35 years of age, mild pain may be present. Urgent ultrasound and urology referral is necessary when testicular cancer is suspected. An infectious epididymitis or orchitis is a common cause of an acute or subacute scrotal pain. The diagnosis is generally made on history and physical examination. Management includes rest, scrotal support, anti-inflammatories, and antibiotics. Also, keep in mind that scrotal pain may be referred from somewhere else, so remember to rule out common causes such as ureteric stones, inguinal pathology such as hernias, and myofascial pain disorders.
Okay. Now, the issue of cysts is really you both have interior and exterior cysts. I knew a gentleman who had exterior cysts that had penetrated through the scrotum sac and was affecting the testes. And it took about 3 weeks to drain all of the pus and to cause it to heal. But at the same time, that created a deleterious function on the testes, so it was less able to generate testosterone as he grew older. This is really important to understand that, especially amongst parents whose children will get they need to be examined as well, so that any lesions or infections, especially if you've got a hair infection or there, that it doesn't get out of control and create a cyst. The testicular wrapping issue, we often have seen that in like stomachs, where your stomach will actually tighten up to the point, twist and then tighten to a point where food can't get through. Well, this is similar to in the testes, where the vas deferens and the gets turned and twisted, and therefore blocks it off, and the blood gets cut off, and therefore that's where the pain comes from. But at the same time, it becomes necessary, to have rapid treatment so that it can be resolved before the loss of the testicle. All right. So we're coming down and says, okay, well, how do we take care of this? How do we feed it? And we just have to know that making sure that we have a very good diet, right? So that our hormones, our glands and our bodies are fed the right foods, so that we can generate the right hormones and we get the right kind of stimuli into the hypothalamus to generate the hormones to the pituitary gland or other glands, as the case may be. What I wanted to add here is that, of course, there are things that you can do that are detrimental to your hormonal balance, and a lot of those deal with the things that we know we're not supposed to do, and especially eat or drink or smoke, and create the inflammation that creates problems within the glands or anywhere else in our body. So keeping known that we need to live a healthy lifestyle in order to be healthy lifestyle in order to be happy and eat the right foods, then we're all in the right place. Now, where we've been and where we're going, we started out with the nutritional health and got into health and mood. We wanted to go through and talk about mood, because mood deals with feelings, and feelings deal with behaviors deal with relationships, and that's all leading up to where we go next, which is into relationships and intimacy, sex and reproduction. And we're getting that information and the basics of it now. We've got some references that you can call upon here listed. And then next week, next slide, we are going to be into the ovaries part 1. Now, because of the female cycle, it's going to take some time to get through talking about the ovaries, because of the complexity of how everything fits together, and making sure that you take away the information, not just hear it, but take away the information. We're going to go a lot slower in presenting and be able to talk about ovaries part 1, and then we will take a break for the weekend of the 12th. And this gives me an opportunity to wish everybody a happy Chinese New Year as it approaches us on the 1st of February, the 15th of February being the end, and that'll be the Lantern Festival. So the weekend prior to the Lantern Festival, we will be taking a break then. So this Wednesday is the 1st, so we wish you all a happy Chinese New Year. And then remember, next week is the 5th of February. We will have class, but we won't have class on the 12th. All right, so that brings us to the end. Let's let everybody come online. Mila, you can stop the presentation on YouTube, and we can go back to